This week on Arizona Illustrated, mental health and the pandemic.
This is constant change, and there's a fatigue to that. So how do you take ownership of some of that change, small things that you can't control, and kind of build on that?
This week's favorite place, Armory Park.
It feels calm, inviting, and full of stories.
And behind the scenes during the Osiris-Rex Touch and Go.
We're going in. We're going in.
And we have touchdown!
Welcome to Arizona Illustrated. I'm Tom McNamara. This week we are again in one of Tucson's historic neighborhoods, Armory Park. Just south of downtown, its name is drawn from a military plaza and armory that was located here back in the mid-1800s. Today it's known for its pedestrian-friendly streets and architectural variety, which might explain why it's also, as you'll see later in the show, this week's favorite place. With the recent reports that coronavirus cases are on the rise, the AZPM crew and I are protecting ourselves and each other by staying vigilant, practicing social distancing, and wearing masks. Here is an update. Arizona is in the midst of an alarming and consistent rise in number of cases per 100,000 and percentage of tests coming back positive. On November 5th, ADHS reported 2,135 new coronavirus cases, the first daily report of more than 2,000 cases since August 1st. A 2-week snapshot of hospital visits with COVID-like illnesses looks steady. However, the November 5th announcement reported 254 COVID-19 patients in ICU beds, the most since August 30th. For more coronavirus information, visit news.azpm.org. The economic and social disruption caused by the coronavirus pandemic is devastating. The constant threat of illness and death, a crippling and ever-evolving economic crisis, and as the International Red Cross recently warned, a global mental health crisis.
Baseline surviving this pandemic is hard. Then you add mental health issues on top. Then you add financial strain on top. Then you add the increased risk of suicide, and you don't have enough support. I don't think that's fair for one of the top nations in the world.
According to the Commonwealth Fund, 45% of American adults who reported experiencing emotional distress also reported being concerned of social and economic needs, compared to only 16 to 19% of adults reporting the same concern in England, France, and Germany.
When we look at other countries, Austria, for example, they went through difficult financial strain. However, they had very strong labor laws and very generous welfare programs in place. So even through their terrifying recessions that they went through, they were able to see a slight decrease in suicide rates. For the US, we have in the last 10 years, so 1999 to 2018, we've had a 35% increase in death by suicide. When you think about anything, if I said there was a 35% increase in death by diabetes, there would be an outcry. There would be an issue of why don't we have healthcare? Why don't we have nurses checking on these people? We should dispense glucometers. But because it's mental health and it carries the stigma, there isn't that public outcry. There is shame and there is stigma that limits the support that people have. And that's, again, an issue. And these are national issues. This is a public health crisis.
Data from the Economic Policy Institute show how COVID-19 has had a disproportionate effect on unemployment rates among younger workers, who predominantly work in leisure and hospitality, where unemployment declined by 41% between February and May 2020.
One of the biggest hit age groups at baseline for us, suicide, the second leading cause of death in 10 to 35 age group. So that's kind of our youth, our future, our optimism almost. And then you also think about unemployment rates are generally higher in that age group. They're also the ones sitting at home now without their friends, without building that social connection, zooming away. And how do you build resiliency in that age group and connection and continue to kind of be motivated to be part of the world? Because the other thing that's happening is that, at least what I'm seeing constantly, is that sense of overwhelming fatigue of exhaustion by the world, election or fires or environment, it's eating away at people and it feels too big and too much, and I can't do anything. And when you feel helpless and unempowered, that also takes away from your sense of agency. I personally get on a soapbox when it comes to parenting and mental illness in terms of how are you parenting and what are you building in a child? Because resiliency is hard to build, failure tolerance is hard to build, frustration tolerance, distress tolerance, those are essential skills, right? The 9 times table is also very important. However, these are also crucial skills, and at times we don't have them ourselves to kind of teach our children and work them through those things. So when you look at historic issues, resilience tends to break like 3 months later. So you see people that are moved by war or hurricanes or floods. Initially, they're okay. They're in this fight or flight mode. And by, 3 months later, they're like, okay, I can't do this. Now there's the stress disorders and the PTSD that shows up. And we've kind of passed that as well. And now we're in adaptation and change. And how do we survive this? And so for those people that have that resiliency and have that agency to be like, let me rebuild my life and get to this new normal, it works. And then there's people that are like, reject this new normal. And that's hard. And those that don't have a choice and they don't have a choice to reject or approve, they just got to live. So essential workers or those that are providing healthcare, their rates of depression have gone up. And that was the CDC study in June. And so thinking about whether you had to go in and feeling like you're an essential worker or healthcare providers or people who are taking care of adults at home, but you have to, because what else are you going to do? There's not any jobs out there.
A new study from Cornell University showed that a significant number of Americans who returned to work in May through July are being laid off again as government payroll protection program funds run out.
Unstable employment or not having a perceived sense of comfort in there, like I could lose my job any day, is also a big factor when it comes to strain and your mental health getting affected. And because, yes, we have people that have been employed again, you're back in your probationary periods. You're not sure if I don't know what's going to happen. Is Arizona going to close again? And am I going to have a job? And that is also, so you may be employed, but that sense of uncertainty doesn't help. And so that also is another consideration. So if you're seeing this and you're thinking about family members and you're like, they just got their job back, still worth maybe a check-in. This is the busiest my clinic has ever been. We have never had this level of demand. I have friends in internal medicine and pulmonary critical care that were running the COVID units, and they were putting in extra work and running overtime, and schools are closed, and these are women I know who have kids at home, and it's exhausting. It takes from you, and it's not sustainable. And I think there is a humanity to medicine and there is a business side of medicine, and it's kind of shifted about where we care about. Do we care about the humanity or do we care about the business?
The Commonwealth Fund reports that more than 112 million Americans live in areas where mental health care is in short supply, with experts predicting increasing shortages in mental health professionals through 2025. Their data shows the urgent need for improvement in policies to expand coverage of telemental health that should be rigorously studied and potentially made permanent as a strategy to increase access to mental health services.
If you're worried about someone, ask them. There's always that question of what's the stigma and all that jazz, and don't worry about it. You're not going to make somebody think of suicide. They've already thought about it. So ask them, and if you're help them with basic things. Making an appointment is hard. Looking up a therapist and figuring out who's covered in your insurance is hard. And if you're worried about a loved one, do those things for them. Help them through that piece. Figure out your social bubble. You can't hang out with everybody, and that's fine. Who can you? Who is your bubble that you're going to interact with and you're going to be safe with together? Because you can't completely be isolated either. And so how are you going to navigate that connection for yourself and for your friends? Sleep, eat. Strength training has some data associated with it. Things that you can do that will change your life, because I think that's the other piece is this is constant change and constant transition, and there's a fatigue to that. So how do you take ownership of some of that change? Small ownership that you can take, small things that you can control, and kind of build on that.
When architect Valeria Moraga was asked to select, write about, and eventually narrate a personal illustration about one of her favorite places in southern Arizona, she needed only walk out her front door and wander the historic and comforting streets of her neighborhood, Armory Park.
As the world has changed so much over the past few months, I learned to appreciate things that are closer to home. After I finish my workday from my computer in my bedroom, the one thing I crave the most is some time outside. Armory Park neighborhood has provided this and so much more. Calmness, curiosity, and awareness are some of the things I feel when I step outside on my late afternoon walks. I live in one of Tucson's historic neighborhoods dating back to the early 1900s. Its architecture consists of different style buildings, from bungalows, Victorian, and contemporary. As much as the architecture is engaging, there's another thing that draws more attention to me: the people that each home represents. From the landscaping, front porch benches, chairs, couches, small tables with coffee mugs, books, and much more. It feels calm, inviting, and full of stories. Each front porch and back alley tells a unique story with a specific charm that it's not overwhelming, even if it looks a bit hectic. The small walks keep my mind occupied while creating curiosity of what is around me. Being able to get out and feel more life other than the few people I see week to week has been one of my little escapes that has kept me going during these times of isolation. The way that classes and culture mix makes this a very unique place. The streets provide a sense of community and integration that it's not usually felt. Its location is only a few blocks north of South Tucson and Santa Rita Park, and just south of downtown. These places bring culture and history that collide around the neighborhood. This can be seen through ornamentation, colors, textures, and items found throughout. During each walk, something new is visible, even if the path is the same. The trees around the sidewalks bring unique characters. The birds singing each morning and afternoon, the dogs barking and the cats wandering about, each integrated peacefully between streets and cars. Armory Park has become one of my new places of contemplation and appreciation through each breath and sound I experience. The walks through its alleys, sidewalks, and streets hold a special part within me. They've helped me more than they'll ever know. Armory Park neighborhood is one of my favorite places.
Be sure to join us next week when we visit our next favorite place, Mount Lemmon. 16 years ago, the moment you are about to experience was imagined. However, what was not clear then was when and exactly how a spacecraft would capture dust and pebbles from the surface of an ancient asteroid more than 200 million miles from Earth. Just weeks ago, on October 20th, what was imagined more than 16 years ago happened. Here is OSIRIS-REx, touch and go.
MSA on OREX-OST. OREX is descending below 25 meters.
Okay, we're getting really close. And I want to remind you, it's the 5-meter crossing.
Yeah.
That's the really critical one. We're only a couple minutes away from that. So the spacecraft has one key decision left to make. It's calculating right now the probability that it's going to come down either on a hazardous area, as we defined on that hazard map, or in a safe area. All my senses are on that call out right now.
Yeah.
I really want to hear that we are go for tag, so that's just a couple minutes away. So you can see here that this is a pretty daunting terrain that we're coming down here. There's giant boulders all around the Nightingale site, even some large rocks inside the crater that we do not think the spacecraft would survive, at least with the ability to return back to Earth if it made contact.
Attitude control system has transitioned to touch and go mode.
All right, spacecraft's getting ready to make contact with the asteroid surface here.
Ten seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. And liftoff of OSIRIS-REx, its 7-year mission to boldly go to the asteroid Bennu and back.
OSIRIS-REx is a NASA mission to send a robotic spacecraft out to a near-Earth asteroid named Bennu, map that asteroid in great detail to select a site on the surface, and send the spacecraft down to collect a sample of material. We're then going to bring that sample back to the Earth to analyze in our laboratories. We're going to an asteroid that dates from the formation of our solar system. Literally the oldest rocks in our planetary system, older than the Earth, and represents the building blocks of our planets. And we're really going after the biggest questions we asked ourselves as a species, precisely, where did we come from? And are we alone in the universe? We want to understand why Earth is such a special place, why it has this wonderful hydrologic system that enabled the origin of life. And we also want to know, where are we going? What is our future? And we look to the stars, and we look to destinations that we can explore. And these asteroids are very accessible, and they potentially hold a lot of resources. And they also represent a significant natural disaster, and we would like to be able to prevent that. We're the first species on Earth that could actually stop an asteroid from hitting, and I think it's worth some of our effort to mitigate that risk.
And just to kind of show you, this is the orbit of OSIRIS-REx.
When we were designing the OSIRIS-REx spacecraft, we performed an extensive astronomical campaign to characterize the target. And when we got to Bennu, we actually saw we did a pretty good job. We really did see this interesting spinning top shape that looks like, it's bulging at the equator. But what we didn't get right, and it was a big oops, was it was rough and rugged and rocky. And at first glance, there was nowhere that looked like we could collect a sample from. And so I knew right away we were in for a challenge, that we were going to have to roll up our sleeves, and we had some work to do in order to figure out how we're going to get a sample off the surface of this asteroid. So we very quickly build up a 3-dimensional topographic map of the entire asteroid surface. And we found some flat areas. And so we decided we were going to design a trajectory. The spacecraft's going to fly over a known area of the asteroid surface, and then it gets to the point where it's going to start going down to the surface. We call that the checkpoint. And then it's going to have to match the speed that the asteroid is rotating, and we call that the match point. So the spacecraft has to calculate its own maneuvers and get it into the target area we call the Nightingale crater as our sample site. And then even then, there's still some things inside that crater that look hazardous. We don't want to land on the big rocks. And then there's the final unknown about what's going to happen when the spacecraft makes contact with the asteroid surface. And to me, the scariest moment is going to be during that contact. The spacecraft could tip over, and if we lose signal, everybody's going to be holding their breath.
They've been around each other every day over the last 6 months. Not going to the grocery store. So I'm really excited. This is a long time coming. I thought I would feel more nervous, but I'm actually feeling great. Just feeling really stoked for today and what we're about to do.
I am very excited about finally reaching this milestone in the project. Sure, I have some nerves. Maybe I haven't been sleeping as well as I could be, but I am just overwhelmingly confident in this team. But we've also never actually touched the surface of an asteroid. That's something new, and you just never know what's going to happen.
I mean, we've done everything we can do to this point, and we just have to see how it unfolds. It's the team that makes this happen, not any one individual. And I think that's probably been one of the best lessons I've learned from this project.
So last night was probably the first night in many months where I actually started having kind of stress dreams. It's an important day. It's, we've been leading up to this since 2004, and there's a lot on the line today.
Earlier we departed our orbit around the asteroid, so we're flying over the sunlit side of the asteroid. The spacecraft has deployed its robotic TAG-SAM sampling arm, so the arm is ready, in position to collect that sample. Once we fire the thrusters for the checkpoint maneuver, we're actually going to start descending down towards the asteroid surface, so this means we're going to be on our way to make contact.
OREX MSA on OREX off. Checkpoint burn has completed.
Okay, we're heading down towards the asteroid surface at this point. So we've got one more firing of thrusters with the spacecraft to get us lined up for the sample acquisition event. We call that the match point.
Once it gets past match point, it's going to be telling us how likely am I to contact a hazard. And we want that to be 0, but it may not be. Especially early on, it could be like, there's a 30% chance I'm going to contact a hazard. So you're kind of trending this hazard calculation all the way down to 5 meters before the surface. It's that final decision on the spacecraft where we know we've committed and this is it. And we're going in to hit the surface and hopefully get that sample. We've worked hard to get to this point. The best times are ahead of us. This represents the hopes and dreams, hard work, blood, sweat, and tears.
OREX has processed its next message. Position uncertainty is 0.5 meters. Predicted tag lateral offset is 1.7 meters. Hazard probability is 0%. OREX has descended below the 5-meter mark. The hazard map is go for tag. Contact expected in 50 seconds.
We're going in. We're going in.
And we have touchdown!
Touchdown declared.
All right.
Sampling is in progress. OREX MSA on OREX op. Sample collection is complete, and the back-away burn has executed.
All right.
We're on our way back.
A little overwhelmed right now, Michelle, I have to say. It's been pretty intense several minutes here. I can tell you that everything went just exactly perfect, which is kind of the hallmark of this team. We have consistently beaten expectations over and over again. We have overcome the amazing challenges that this asteroid has thrown at us, and the spacecraft appears to have operated flawlessly.
I think I'm just in shock at how well it went, just like relief.
Oh, I'm absolutely elated, so excited, so happy.
I'm feeling so incredibly relieved.
Hey, woohoo, we did it. Yes. So many years. All culminates in, what did he say, 4.5 seconds of touchdown. And just looking forward to getting those images tonight. After that, I'll be able to sleep for a while. So, go OREX.
Well, I think one of the greatest outcomes of space exploration is the realization of how fragile and how rare the Earth is, and how special a place it is, and how lucky we are to be here. And we really need to work hard to take care of it, and to take care of each other, and to work together to solve the problems that we all face. Because we can do that. Humans can do amazing things when they come together with a common vision, and OSIRIS-REx is just one small example of that. So the samples from OSIRIS-REx will land on Earth in September of 2023. And we're particularly looking for the building blocks of life. I think it'll be a pretty emotional moment because I will, at that point, have dedicated well over 16 years of my life to getting to that point. So I think I might relax a little bit and say, okay, we did something that was incredibly hard, we did it incredibly well, and now it's time to celebrate.
Before we go, here's a sneak peek at next week's special episode of Arizona Illustrated, Understanding the Bighorn Fire.
Fire is an incredibly important part of the web of life in southern Arizona and natural biological cycles. And it definitely has a role, and we need to let it get back to playing that role. But when fires happen these days, they happen in a context of forests that have already been seriously damaged by human impacts over the years, and a lot of different types of impacts. But probably the biggest one is fire suppression. So for decades, for actually a century now, we have not let fires play their normal role on the mountain. And therefore, when they happen today, they happen differently.
Rarely is wildlife overrun by wildfire. They're fleet of foot enough to get out of the way, or in cases of smaller creatures, burrow underground. And these animals, for generations, are adapted to these fires. Yes, maybe they're not where we would expect them to be. You know, you never know, because it's wildlife, and they do what they want to do.
From the repeat photography that we've done in the Chiricahuas so far, it's apparent that ecosystems at the lower level of it, for example, the pine oak ecosystem, they're susceptible to losing particular species that need cooler conditions. Cooler conditions are wetter conditions. And so our primary concern with the bighorn fire would be losing forested areas and having them turn into scrubland, just because it's now a bit warmer and drier.
Thank you for joining us here on Arizona Illustrated. I'm Tom McNamara. See you next week.